Hey everyone, welcome back to the Self-Work Podcast. I am your host, Dr. Bundi, a psychiatrist, and on this podcast we talk about everything that has to do with mental health and wellness, from the aspect of self, how we view things, from how we interact with others, and how we interact with our world. If you are new here, welcome, and I want to invite you on a journey of self-reflection. So come along with me. Today we will be talking about trauma. What is trauma? On my social media platforms, specifically on Instagram, I've been engaging my followers on a deeper conversation, and I want us to investigate what is trauma, because it's a word that has been it's been a buzzword for the last 2-3 years. What's trauma? I've been traumatized. I went through a traumatic experience. What do all these mean? And that's what we will be talking about today. So starting off with a basic definition, trauma is an experience. It's a lived experience that puts you through an emotional, physical kind of pain. It's an unpleasant experience, and it gives you some emotional, physical kind of pain. And it's important to tap into the fact that when you're describing trauma, it's not so much about what you went through, but about what an experience made you feel. And what do I mean? Some people think that it has to be a certain experience that can be considered trauma. It has to involve a life or death situation. Gender-based violence, for example, is considered trauma. And, there are some people who refuse to think about trauma in other experiences. Somebody reached out to me on my social media and told me that they lost a pet. Their pet died. And when their pet died, nobody seems to understand that they're traumatized from that. They've been feeling like nobody really gets it, and people are downplaying her lived experience of trauma. And that's what I'm talking about. It's not so much what you went through, but an experience that really rips you apart. Some people reach out to me after having experienced a heartbreak. And they tell me, I feel like I can't talk about this anymore because this heartbreak was in 2018, but I'm not dealing. But I can't talk to my friends or my family because they seem to think that this thing that you went through in 2018, shouldn't you have gotten over it by now? So again, with trauma, it's also not about a time period. You could have experienced a traumatic experience in childhood and it's still affecting you now. So I like to look at it in this way. If you went through something that hurt you then and is still hurting you now, it somehow manages to reach into your current life and is still causing you pain right now, that is trauma. So what are some of the symptoms of trauma? When you've gone through a traumatic experience, you might have what we call intrusive thoughts. Okay, you're at work, you're driving, you're going about your normal life, but bam, a thought pops in and just reminds you of the thing that you went through. Intrusive thoughts. And that one is closely related to flashbacks. So again, a flashback is where you literally transport from where you are now, you go back in time, and it's like you're almost experiencing the thing all over again. So flashbacks are also a symptom of trauma. Another one is rumination. So when we talk about rumination, think about, I think it's cows. Cows are the ones that ruminate, like they kind of chew the same piece of grass over and over and over and over. Like cows can chew on a piece of grass for like a long time. Listen, I'm not a vet, but I do remember somewhere like learning that the word ruminate comes from cows just like chewing and chewing the same thing over and over again. And that's what trauma does to you. You ruminate, you find yourself thinking about that experience over and over, even multiple times a day. You kind of ruminate and hold on to that thing. So that's another symptom of trauma. Trauma can produce physical symptoms, and this most people don't tend to know. Muscle tension, neck pain, migraines, heartburn. Trauma can actually cause physical pain. And that's why I was also reading this the other day, that heartbreak, and the reason, like, heartbreak can actually feel like pain in your heart. Like, have you guys ever been through a heartbreak or a painful experience? And when you think about it, like, your heart hurts. Like, have you ever gone through something that is just so painful? You feel it right here. That's trauma. That's trauma. Another symptom of trauma is it changes you. It changes the way you think. It changes the way you relate to other people. Have you ever been through such a traumatic experience? It changed the way you interact with people, the way you see the world. You used to be happy. You used to be outgoing. Now you're kind of like shut off from the world. You don't want to relate with anybody. You don't trust anybody. That's the trauma. That's the trauma. The trauma has changed the way you are. It's changed the fiber of your being. That's what it does. So those are just some of the symptoms of the trauma experience. Okay, so what can it do to you long term? Let's talk about some of the things that come up because of trauma. Trauma can produce something called PTSD. This is the most severe form of a traumatic experience. It stays with you. It has a whole diagnostic criteria that I will not go into it because I don't want you to be listening to me and trying to diagnose yourself with PTSD. PTSD is a condition that can only be diagnosed by a licensed mental health professional, okay? But if you feel like you've been through a traumatic experience, it would then be good to go in for an assessment to screen you for PTSD. What other symptoms can come up from trauma? We have insomnia, lack of sleep, anxiety, something called acute stress disorder, where you're just constantly stressed after a traumatic experience. So these are just some of the conditions that can come up because of trauma. And the reason I'm highlighting them is not to scare you, to make you feel like, oh my gosh, I'm going to get this and that and this and that, because Dr. Bundi talked about trauma. No, I want you to know that you should not dismiss a traumatic experience. Don't dismiss it, because you don't want 2-3 years down the line to then have PTSD, because moving backwards from PTSD is harder than correcting a traumatic experience when it happens. Okay? And what does trauma healing look like? What is trauma healing? Can you heal from trauma? Of course you can. Yes, you can. Yes, you can heal from trauma. And the first thing that I'd like to mention is, if you feel like you've been through a particular traumatic experience or trauma, it would be good to get into therapy, but it would be even better to connect with a therapist who has experience with trauma work. Not every therapist is experienced with trauma. There is specific trauma therapy. And I want to be honest and say that I myself have minimal experiences with certain types of trauma. And when I experience these kind of patients, I make it known that I would rather refer you to somebody who is very experienced with trauma. So heads up, if you feel like you need trauma therapy, make sure you investigate and interrogate your therapist. Do you have experience with trauma? So that you get the best help for you. And what does trauma healing look like? What's the process? What does it look like? Number one is it's a journey. It's not a destination. You're not just going to immediately go for 1 session or 2 or 3 or be prescribed a medication and then be healed from trauma. That's not the way that it works. It's a process. And along your trauma journey, you might reach a point where you feel, I'm healed, but then you will still find bumps along the way. And what are these bumps called? They're called triggers. So in trauma healing, it would be extremely important to identify what are your triggers. And the way that I like to describe triggers, and I got this from another creator, another psychologist on TikTok, and they were saying that a trigger is something from your past reaching into your present life and wanting to drag you back to feel the same way you felt 6 months ago or 3 months ago when that thing happened. So it's literally, imagine a hand cutting through time and space and coming into your present life and trying to drag you back to feel the way you felt when you went through the breakup, or when you went through, when you went through that experience. Those are what triggers are. So in that moment, when you're experiencing a trigger, the one thing you need to ask yourself is, do I want to go back to feeling how I felt 6 months ago or 2 years ago? So you have a decision to make when you experience a trigger. Listen, we can't control what happens when we are triggered. We can't control experiencing triggers. We can't say that I will never have a trigger in my life. You'll always have triggers. What you can control is how you respond to triggers. How you respond to them. Are you going to allow this trigger to make you have a meltdown, to make you cry, to make you shout and lash out at somebody? So when you experience the trigger, the most important thing is to know that this is a trigger and it's trying to take me back to where I was. And then you make the decision to not let that happen. Identifying your triggers, right? The other important part about trauma healing is you're going to experience some changes and some shifts in your relationships. Because there are some people who knew the traumatized you, and they got so used to the traumatized you, the part of you maybe who played small, or the part of you who was a people pleaser because of your trauma, the part of you who had no boundaries because of your trauma. There are some people who have that image of you. And when you're going through your healing, they kind of don't understand that the new person that you're trying to be, or the healed person that you're trying to be. Some of those relationships will have to shift. You might have to have some very difficult conversations with people. These people might even be your family. You might have to let some people go. Some people who don't want to accept that you're a new being, that you're coming into a new space. Some of them are going to have to go. Some tough decisions have to be made, and that's why trauma is not comfortable. If you're feeling comfortable in your trauma healing, then I have to question exactly how much healing you're actually doing. It's work. And that leads me to my last and final point. Trauma healing involves a lot of self-work. I see so many patients coming into therapy for trauma, and they kind of want the therapist or the psychiatrist to do the heavy lifting. Unfortunately, that's not how it works. You don't go to therapy to get the answers. You don't come so that I can tell you, this is what happens and this is how we fix it and this is how you heal. It's a collaborative effort. And if you're not at the point, if you're not ready to do the heavy lifting, to do the self-work, for example, managing your triggers, I won't always be there with you when the trigger happens. You've got to do the work. You've got to do the self-work. Okay? And so that's basically a synopsis of how trauma healing works. And I know it's not easy, it's painful. There are times you'll even question, am I actually healing? You'll question your healing journey, but keep going, keep pushing. Healing is not comfortable. Don't doubt it just because it feels uncomfortable. Okay, so that's the end of my episode, guys. I really hope you've enjoyed it. And from wherever you're watching this, if you're watching it from YouTube, from Spotify, whatever podcast platform you're watching this from, please hit that subscribe button. It gives me a lot of visibility. It helps other people see this, people who might need this. Please remember to share it with your loved ones, because guess what? You're not the only one who's gone through a traumatic experience. Please help others heal. Right? And with that, I will end this episode, and I will be sending you love and light in your healing journey. If you've got any questions, please feel free to hit me up, and I will see you next time on the next episode. Bye, guys.